Thank you very much, Neil. Thank you for the organizer to invite me. My presentation integrates the previous two presentations, that very interesting way to approach the problem of the pain. Because we know in the pathology, all our organs, all our system may be affected by pathological condition and create a painful condition. So there is no organ that unfortunately do not send the signal that is a suffering. And the signal, the first signal is the pain. So it's a symptom. In the field of rheumatic disease, we have almost 200 different conditions. So you can imagine how difficult when you have pain in the shoulder, for example, start to think about, which is the most possible causes. But as the first lady that said, we consider pain as a symptom, but we want to know what is behind the pain. And behind the pain, there is a tremendous, serious situation that today we are able to distinguish, to investigate, even with non-invasive systems. And now we can really, from the area of the painful condition, try to see, without invasion, what is going on. And what is going on? In the majority of our problems, there is an acute inflammation, the acute pain we call, and the acute pain may finish, because finish the cause, or we treat properly, but unfortunately, in the field of rheumatic disease, but even and especially in disease that become systemic, the pain continues and become chronic pain. And this is the second level of alarm. And the pain become chronic. And this is a frequent condition in the field of rheumatic diseases, especially degenerative diseases. But unfortunately, what happened at the level of the tissues, it's very complex, I cannot explain here, but all the cells change phenotype, change word, change job. And at the end, sometimes happen also something that we don't want. Of course, if we in some way can resolve the pain, we don't resolve sometimes the chronic insufficiency or invalidity. No pain, but still the result of the inflammation, the chronic inflammation. And this is, the pain may be strong, less strong, but what is another consequence of the chronic inflammation and is the progression, the damage in the tissue, the activation, growth factors, angiogenesis, proliferation of the cell, grow of the tissue. And the growth of the tissue means at the top of the chronic inflammation, cancer. 15% of chronic condition become cancer. And here, maybe the pain is present, is not present, depends on the tissue. But we develop a cancer. So this is a very important cascaded event that is under the control of the neuroendocrine immune system. The central nervous system, all the endocrine system, from the adrenal gland to the thyroid to the gonadal glands, and the immune system, and all the cells that defend us from the injury. So this complex mechanism, the network in chronic disease is altered, and it's lost the piece between the component. And this is a real problem. And the real problem is the rhythm of the pain, because our life is under the control of the light and the darkness. The heart rotates, and then we have symptoms that are during the day changing, the pain changing during the day, even during the season change, because change the sequence of the darkness and light. So this is important because our brain is a clock, is a central clock. Feel the light, feel the darkness, and produce nocturnal hormones. And the nocturnal hormones are involved in immune response, in attack of the antigens, of the foreign substance, even the cancer cells attack. And so every night we activate inflammation. And as a consequence of the inflammatory reaction, in the morning we get the symptom. Think about rheumatoid arthritis. Classical symptom is the morning jelly, stiffness, because during the night biochemistry of the inflammation is strong. And so you get the symptom, the pain mainly. And then the pain reduces as the concentration of cortisone increase, or the therapy works. So this is important because from the periphery, the brain receives from the mediator of the inflammation all the signals, cytokines, prostaglandin, and so many things, and react. And in chronic pain, the threshold goes down. And so the people suffer more and more, and they have also secondary fibromyalgia, and so they don't suffer nothing. They are depressed also. And this is the complete destruction of the network. So the neuroendocrine system control even the sequence of the pain during the day. And so the symptoms are very high in the morning, usually, and less during the day. And this is a hormone, a hormonal regulation. You know, for example, that even for acute inflammation, gout is in the night, never in the day, because in the night we have all the condition for this reaction. And during the night we know very well, in rheumatoid arthritis very well, the morning's pain. And in spondyloarthritis, polymyalgia rheumatica, all the chronic inflammatory conditions in our field are characterized by circadian pain. And so here it's important also to think about how to manage the pain, to consider the circadian rhythm, in order to save the amount of drugs and even to optimize the timing of intervention. Are all these very important aspects, because in Europe we have 120 million of people that experience pain, and the majority comes from the musculoskeletal system, unfortunately. And you will see some numbers. And so it's important to know that, because now the European Commission, after many meetings done with our office, consider now as between the chronic disease, musculoskeletal and rheumatic disease, among the most important chronic conditions that must be considered and supported. And you see here that rheumatic and musculoskeletal diseases are the most prevalent group of diseases, and from 2013 considered, and about the quality of the life of 70.5% of the European population is reduced by chronic pain, as well as 1/3 of European citizens at all ages suffer from rheumatic disease at a point of their life. Maybe a baby say, cry because they have pain, and we found the disease, and so on, and so on, and so on. And so 85% of people between 20 and 72 years suffer in some way of musculoskeletal pain. Maybe acute, okay, disappear, may become chronic, and so it's a question of long part of their life. And 5% of people between 20 and 70 years suffer, 72 years suffer from musculoskeletal pain every day, every day. So if we look at the incidence of pain arising from rheumatoid arthritis, of knee pain and osteoarthritis, or low back pain, you see that during the productive period of our life, when we start to work, the majority of the problems rise, especially low back pain. Sometimes it's related to the job. So it's important to consider the quality of the condition of the workers, because this is a cause of chronic pain in the majority of the condition, especially for the spine. But even other conditions like the stress is a strong enhancer of immunity, autoimmunity. And so the stress is one of the most important causes for push the development of chronic autoimmune diseases, for example, like rheumatoid arthritis, systemic lupus, and so on. So I think we must conclude that we have two important blocks of therapy in the field of rheumatic disease. This is a review we are going to publish on Nature. And the first block is a non-steroidal anti-inflammatory and other drugs that we still don't know how works. And the gold, for example, is not anymore part of our therapy. And the new drugs are targeted therapy, so are able to target single mediators of the chronic inflammation, and so of the chronic pain as a symptom of chronic inflammation. So we can say that Euler is a large, can I say, farm, doing a lot of things. And we are working for the patient. And the patient association inside the Euler is very strong and growing, and help in any initiative of Euler to improve, looking at the reality, evidence-based diseases. And this year, for example, we got almost 5,000 abstracts, in large part also from allied professionals and patients. And you see here is increased the participation of a country like China and other countries that are coming inside. And China will bring 1.5 billion of potential chronic pain. So, in conclusion, pain is an early symptom. It's an early symptom in early disease. and excluding conditions that we know are arising inside the nervous system, so are inside the system of signaling. And other important condition concerning rheumatic disease that in inflammatory pain has a rhythm, classical rhythm. And so we must try to optimize the intervention in order to reduce as much as possible the side effects of the long-term treatment of chronic therapy with non-steroidal, anti-inflammatory, and other approaches. And finally, this is one of the topics of the EULAR, to optimize the treatment of rheumatic musculoskeletal disease to find the best way to control pain. And we can say that today, having a system of treatment from the beginning that try to stop the progression of the mechanism causing the inflammation, the chronic inflammation, so the pain, targeting mediators, we are really close to realize to reduce the pain by the causes, and then helping to reduce the pain once we know which is the cause, helping the patient to feel very well, very well. Thank you very much.